Hi, this is John Kanellopoulos from our center here in Athens, Greece, the Laser Vision Ambulatory Surgery Center and clinical professor of ophthalmology at NYU Medical School in New York City. Our favorite subject, keratoconus, and this is a 30-year-old physician, and this is the left eye. He was diagnosed 1 month ago with keratoconus. So this is a testament that keratoconus does not choose patients. This is the right eye that's ranked with the axillary chromite criteria on pentacam as keratoconus stage 1. Although we're seeing here keratometries in the 50s and 43.4, so we know that since this is a central cone, this slight differential really underestimates the amount of the cone the patient has. He's wearing a spherical equivalent of about a -1.5, but we know there's much more myopia hidden here in this ectasia. He obviously picks a sweet spot here. Left eye is obviously better. It doesn't clock as keratoconus on the pentacam, but we can see with the steepest level of 49.3 that it's not far away from the right eye. They're more similar than dissimilar. So he's 30. Should we do cross-linking? The cornea thickness is not that bad. The answer lies in the cornea pachymetries, and these are the Avanti anterior segment OCT maps. Thinnest cornea is in the 500s, to be exact 523, but on the right eye we see there's significant epithelial remodeling, and sure enough the patient confirms when I told him you sleep on your right eye, indeed, and I also sleep on my left eye. And we see active keratoconus here as well on the left eye. We discussed it with our young patient physician, and our recommendation here is, since the keratoconus is active, is of course use a mask as we have described. You can find on our YouTube channel a do-it-yourself pillow mask to avoid pushing the eyes while he's sleeping. It's very difficult for someone to change their sleeping patterns, and Athens protocol here on this age at 30 with an accelerated CXL profile to improve the cornea ectasia and also correct significant amount of myopia. But if we just normalize this cornea, I would bet with keratometries in the 50s, we would invariably have the surprise of 2 or 3 diopters of myopia. And this is an important thing and point I want to make, that in a lot of these cases, we underestimate the myopia that was there. All we have to do is see the steepest part of the cornea and the actual length measurement and estimate what the real myopia would be in this patient. And we would guess on an actual measurement of 24 millimeters that the real myopia here is about 5 to 6 diopters. And this is something that has to be anticipated when you reshape the cornea, either that with topography guided or with what we reported recently, and it may be applicable to him with the ray tracing using the Wavelight Plus platform by Alcon off-label. And the advantage of ray tracing is that it will view this cornea slightly tilted, and it will treat most superior nasally and very little on the cornea thinnest point in both eyes, the left eye respectively, as a tilted cornea like so, and treat more in this area up here and less on the thin ectatic cornea. So take home message for us, keratoconus is epithelial maps. If there's blue in a patient that does not wear contact lenses, it's active. This is testament that not only the patient rubs their eyes, but they sleep on their left eye. They put their hands down and their eye lays closed, obviously, on the knuckles of that hand. And during the sleep, there's a lot of mechanical intervention to the cornea. This is an active keratoconus even at the age of 30. Even if the patient was 40, we would still recommend cross-linking here. If the patient was 25 and the epithelial maps were all green, then we would probably follow this patient. If this was an 18-year-old, we would recommend treatment immediately. At 30, we give the patient a 3-month window, as he's a young physician, he's very busy, but we wouldn't let this cornea go for a year without offering treatment. Hope you found this information helpful. This is John Kanellopoulos from our center here in Athens, Greece, signing out. Thank you very much for your attention.